Heading on to the next session that will be anchored by Adereti Adebobola. So he'll be talking to us about opportunities in health tech for students and graduates. I'm sure we have a number of people in this population and category amongst the audience. So it's an opportunity for you to learn from Adereti Adebobola. Thank you very much for your attention.
Okay. Good afternoon, everyone. And my name is Adereti Adebobola. I think I should share my screen. Yeah, share my video and share my screen. Okay. Yeah. All right. Good afternoon, everyone. And my name is Bobola Adereti, and I am here to talk about opportunities in health tech and also about promoting the iCube.2x community, which is where people can learn tech skills and also have a niche in health tech. Yeah, so I am excited to be here to talk about this opportunity, and I am also a staff in iCube, and I am also grateful for the opportunity to sponsor and power this health tech workshop. So just to talk a little bit about myself, just as any kid that grew up in the Nigerian educational sector, I always had a dream as a kid to be a medical doctor. And I also worked towards it, but unfortunately or fortunately, I actually ended up in the natural sciences field. And yeah, I tried, but the reality actually is everyone cannot work in the ER, OR, or the surgical blade. And I always held on to my goal, which was basically to save lives and also to enhance and improve the quality of human life. I started exploring opportunities about how I could achieve my goals where I was, and I also started exploring and looking for openings about how I could impact the healthcare field from outside of the medical field. So my journey into software development started in 2020 during the COVID pandemic, where I was advised by my brother to actually explore tech and look for a niche that I might be interested in. And that was when I stumbled upon software development. And ever since then, since I already have an existing background in biology, and I was also exploring tech then, specifically software dev, I was looking about opportunities, how I could actually incorporate tech with my existing biological background. And basically for me to achieve my goal, which has always been saving lives, improving the quality of human lives, basically. So not to take too much of our time, we are going to be talking about the health tech field in Nigeria. Yeah, okay. So in the present country, in our present country, present reality of what we have, patients are actually still being wrongfully diagnosed. There is still not enough patient records. It's even close to non-existent. Patients still need to carry files between departments in the hospitals, have to move from one hospital to the next, carrying their files, still needs to do things manually. And I actually see that and consider that as a Achillean tax. And these are things that could be streamlined and done in a more efficient manner. Sadly, people are actually still wrongfully diagnosed, and it's also one of the contributing factors to the poor healthcare in the country, where people are being treated for even medical conditions or diseases that they do not even have. And we've seen this happening to a lot of people around us. And well, instead of just complaining from the outside, we could as well brainstorm and think about solutions about how these things could be handled more efficiently and better. So we are going to be talking about health tech. What is health tech? Health tech is simply healthcare plus technology plus data. It is the application of skills, digital solutions such as software and AI, and organized knowledge to improve patient care, streamline healthcare delivery, and enhance quality of life. So when we are talking about health tech, it's basically health plus tech. It's basically how technology can be applied to the healthcare field to basically to deliver better and more efficient care to human life, basically. And why does healthcare matter? Um, health tech matters because healthcare is actually data intensive. There are a lot of patient medical records that need to be kept, but unfortunately, they are under optimized. In developing countries such as ours, Nigeria, and also Africa as a whole, we have a growing population and we have a booming population actually, but we have limited healthcare infrastructure and also about treatments, efficient diagnosis and treatment for this ever-growing population. And this provides a huge digital gap. This gap basically provides an opportunity for health tech to thrive. And this is one of the few fields where your code and your skills can literally save lives. Yeah, so we have a little opportunities in health tech. Some of us might be wondering about how tech can be applied to the healthcare field. And one of the most common we have is for software development or software engineering. And the first is about hospital systems. In our previous presentation, we talked about having to keep proper medical records for patients. And just like I said previously, patients still have to document their records on paper. They still need to carry files between departments. We do not even have a proper medical record in the country, and this is one of the gaps where software engineering can actually come in. I'll be talking about a typical use case where software engineering can come in this case. So for software engineering, we also have telemedicine platforms, which we've also talked a little bit about in our previous conversations, and also about gaps that the telemedicine platforms can cover, challenges that such platforms encounter, and how such challenges can be fixed. We also have APIs for health data. So a typical use case where software engineering can come into hospital records or electronic medical records basically is about creating a platform that basically bridges the gap between medical professionals and patients that need the consultation of these medical professionals. Unfortunately, there is still a lot of gap between booking a doctor's appointment and patients to actually be attended to. And this is something that doesn't need to take so much effort. We can actually bridge such gap by connecting doctors to patients right from the comfort of their home. It could be an emergency situation where a patient just needs a doctor's consultation and maybe and possibly a prescription, and they do not need to go through such effort to find their way to a hospital and start booking a doctor's appointment. One way is to build a portal that connects doctors and patients. This could be through a USSD service, which was also previously mentioned in the last presentation, and it could also be through video conferencing. And one other option, which is faster, is also an audio presentation. It's basically where a patient dials in to speak with a doctor, and there is a medical professional on the other end of the line. And this is also where the electronic medical record comes in. The record for most patients should have been collected, and they should be carefully and efficiently stored. We do not need to start wasting time to start asking for basic infos that should have been gotten or that should have been kept previously by medical professionals. So this basically bridges such gap, and is also one of the efforts that the iCube Labs has also been exploring, the telemedicine platform. And over the last couple of years, the last couple of months and years, it has actually been a success in its own way. And this is something that also needs to be adopted nationwide or continent-wide, as the case may be, because right from not just even in the rural cities, even in our mega cities, example, Lagos, it's still a very Herculean task to book a doctor's appointment, and then it takes a whole lot of time to get attended to by a doctor. And the suggestion of a telemedicine platform in cooperation with the electronic medical records is actually an opportunity and a gap, and how health tech can efficiently and quickly deliver healthcare to people that need them. A second opportunity in health tech is data and bioinformatics. We have different omics research, which is where I am more proficient because of my biological background, as well as my existing technological skills. We also have epidemiology data analysis, as well as drug discovery or drug designs or primer designs, as the case may be. And what data and bioinformatics basically means is biology plus tech. Basically, it's about the development of methods of the development of methods, solutions, software, which basically helps to break down complex biological data to understand and to fish out intervention points, where these intervention points can in turn be used to improve and advance the health of humans or animals or plants. Other opportunities we have also is AI and machine learning. Such examples of such is disease prediction models, medical imaging analysis, as well as chatbot for triage. Where the AI and machine learning basically comes in is for disease prediction. This is basically about predicting a disease before it even occurs. And one of the research where this is prominent is in oncology, which is basically our cancer research. It helps us to predict, or a disease is bound, or there is a possibility for this disease to actually occur before it even manifests. And it helps us to start treating them before they get to the stage where they are life-threatening. Example of such research, as I previously mentioned, is cancer research, and it also helps us to better understand cancer, basically what cancer means, what causes cancer, how can cancer be treated, or how can it be prevented. And example of such is actually understanding what causes it. Most of what actually causes this is the most common factor for that is actually in the genes, and also how to better diagnose and treat these cancer cells, these oncogenes as they are called. And one of the most common ways is basically to starve out these cells, because we know that they feed on other healthy cells, and if we can starve them out, then they basically die. So AI and machine learning is also one of the fields in health tech that helps us to fight or to better understand this field of research. We also have DevOps and cloud, which basically is about a faster, more efficient way to deliver our software. It helps us basically to ship our software to end users that need them, and it helps us to scale them vertically, or well, to actually scale them as our traffic grows. And it also helps us to secure our patient data systems. Example of such is in our electronic medical records. It helps us to secure our records. Well, because every patient record that is taken down also needs to be better secured. And these patients also needs to be assured that their records are safe. One of the last opportunities, well, this is not an exhaustive list, just a little bit of my research. And the last I have on my list here is public health tech. And this basically covers disease tracking dashboards and health campaigns using data. It isn't just enough for scientists to carry out research in their little lab, in the little corner of their labs, and get their results from the research they make. They also need to be able to communicate the result of such data. And this is where public health and also data science comes in. The results from each research needs to be communicated, the intervention points gotten, the treatment strategies, the diagnosis strategies, they also need to be communicated to other people that might want to replicate such research. And this is where public health tech and data science also comes in. There are also a whole lot of opportunities in health tech, and just for the little time I have, just these are the little ones on my list. So moving on, we have common problems encountered. For people that are wondering how to get started in health tech, most people do not know where to get started from, or people even start and then do not complete the journey. We have actually been there. I have actually been there, because it isn't a journey that is easy. It takes a whole lot of mental courage and strength and determination to embark on this journey and see it up to a productive point. Some people learn but do not know how to apply their knowledge, because there are no reward projects they can apply their skills to, or their knowledge to, or there's simply no community or mentorship. This is where iCube.2x comes in. With the help of iCube Labs, I together with my amazing teammates, building the iCube.2x community, which is basically the health tech field is also a gap that we are trying to fill. So what is iCube.2x basically? iCube.2x is an open learning and exchange community where people learn together and collaborate together with peers. And it's also a mentor-based learning, where you don't just learn together with your friends or learn in isolation. You also learn with guidance from industry experts, from thought experts in that field. And you also have access to curated resources. Resources are actually being curated by industry experts, which basically helps you to streamline your journey. It isn't just about jumping into a field and then trying to learn everything all at the same time. You need to be able to know where to get started from, and also how to progress in such field. And there are also suggested projects where you can actually apply your knowledge and skills. And these projects can in turn be used in real world scenarios to solve problems. Example of such is in the health tech field. One of the few ways to join our community basically is you can actually scan the QR code on the screen, and we also have various social media platforms where you can get started from, and you're also encouraged to invite people to the community as well as join the community yourself. Yeah, so just a little bit of recap about what I have been talking about. Um, yeah, so healthcare in the country, when we talk about healthcare, everyone's mind or most people's mind goes to the medical professionals, our doctors and nurses and pharmacists and co, right? But it isn't just our medical professionals that can actually save life or improve quality of human life. We could also contribute, well, as techies from outside of the medical field, we can also contribute in our own little way to basically improve the quality of human life. And there are various such opportunities to do that. There are various such opportunities to do that, either through software dev or AI or machine learning, or for those of us that are in the natural sciences field. Example of such is probably botany, zoology, biochemistry, or microbiology. We could apply tech to our existing biological knowledge, and we can start working on our own personal research basically to uncover intervention points where these intervention points can be applied to improve the quality of human life. And also speaking about the IQ.2X community, there are various tracks where people can get started in the community. The community offers various tracks based on the niche you might want to explore or want to be proficient in. Example of such tracks include the front end engineering, the back end, DevOps and cloud, the AI and machine learning, as well as data science and analytics. Well, if you are wondering about where to get started in tech, or you do not know where to get started from, or you are looking for a community where you can learn together with peers, where you can learn with the guidance of industry or thought experts, the Archive.x community is for you, and you are encouraged also to check out and join our community. Without further ado, yeah, thank you so much for the opportunity to have this little talk with us all. And if there are any questions, I think I'll be taking any questions any of us might have. Yeah, thank you so much, everyone.
Thank you so much, Adebobola, for that insightful session. Okay, there's currently no question in the chat. So we have a bit of time. I would like to reiterate what Adebobola said, right? Which is, you can learn tech skills at iCube.org, right? It is a community, and it is very, very different from your traditional learning platform where you're given a course, you have a time you're supposed to complete it, you do assignment, at the end of the day, you collect certificate. So you use like 3 months, 6 months for a program, and you don't even have a project to showcase that, oh, I have done this, oh, I know this. Then you now start looking for, oh, where do I want to start projects? iCube.org is very, very different from this. So at iCube.org, it is mentor and project based. So from the sessions we've had, I know it's been a lot of sessions, right? But everything is interrelated. We've had Dr. Okweyimeka say that you should start from where you are. You should start building from where you are. So it's very possible that you know what to build, but you don't know how to build it. So at iCube.org, there are different learning tracks where you can learn how to build things, right? I think there is front end. Adebobola, can you walk me through the tracks again?
Yeah, correct. So part of the tracks that we have in our community includes front end engineering with AI. We actually encourage the use, and we also actively incorporate the use of AI into every learning we make in the community, because the trend currently in the tech space, basically is moving towards the use of AI. It's basically screaming use AI or be left behind. So we actually encourage the use of AI in each and every of our learning and projects. The use of AI basically helps us to ship products faster. And it isn't just about just prompting our AI models to build this for me or build that for me. We also need to be able to understand what or the code that every of our AI model is writing for us. It isn't just about copy and paste it into our terminals and then running our apps and whatnot. We need to be able to understand what each line, what each block of code, what it does. And this is basically what is going to determine, well, the next set of superstar devs that we have that would have in the next couple of months/years. It would basically revolve around how efficiently can you use AI. So for our tracks we have front end, back end, DevOps and cloud, AI and machine learning, as well as data science and analytics. We also have dedicated tracks and channels for newbies in tech, and also for teens. The Tech for Teens and the newbies in tech track is basically dedicated to people that do not have pre-existing knowledge in tech and they do not know where to get started from. So it's the tracks and channels are basically to help you find what is going to work for you or what would most likely work for you. And you are also going to be encouraged every step of the way, together with your mentees, with your fellow mentees, with your mentors, as well as industry and thought experts. Yeah, thank you so much.
Thank you, Adebobola. So before you go, can you please just show us that slide again that has the QR code? So it's possible that some people did not scan the code. So if you're on this call, tech person, you're a health person, and you want to join iCube.org, I need you to scan the code shortly. Adebobola, can you please show us the code? Thank you. So as has been iterated, so far, start from where you are, ask questions, look for people that are already doing what you want to do. And iCube.org actually offers that. So you don't have to sit in the corner of your room thinking of, oh, where do I start learning tech skills? Do I have to pay for this skill? Because iCube.org is even free again. And you have somebody that has built something, they are telling you that, oh, this thing you did, don't do it like this. They save you a lot of time. So I need you to scan the QR code now and join.
Yeah.
Okay.
Thank you so much.
Send a thumbs up if you've scanned the code or taken a screenshot. All right. Thank you so much. So thank you so much, Adebobola.
Yes, thanks so much. Yes, thank you so much, everyone, and I'm honored to be part of this workshop. Yeah.
Okay. So someone said he hasn't been able to take the screenshot. Adebobola, please, can you project it on the screen again?
Yes, definitely. So I think I'll be leaving my screen on for a couple of minutes to enable people grab the QR code. Yeah.
Okay. Thank you so much. So we had an exercise earlier. It's been a long 4 hours, and I want to thank everybody for taking the time to still be here. So if you were not a part of the networking session earlier today, I would like you to be a part of it. So what we did earlier today was everybody introduced themselves, what they do, where they are from, and also added their LinkedIn profiles. So you can do that in the chat, right? At least for the next session, add your LinkedIn profile, what you do, your primary skill. Everybody, you can now scroll through and connect, right? So the next session is going to be an interactive one as well. We have an HR professional who will speak to us about resume and CV review and LinkedIn optimization.